So certainly challenging times for us, unprecedented changes. But without a doubt, one of the biggest things you'll see when you come to our office is a big emphasis on infection control. We had sterilization procedures implemented before, but now it's just so much more intense. When you come into our office, you'll notice throughout the office we'll have HEPA filters. We have diffusers with hydrochloric acid. You'll notice everybody's going to be wearing gowns. You'll notice head covers. You'll notice N95 masks that are the safest masks that we can wear. So definitely you're going to notice that. As far as the virus is concerned, it really is not being passed around in dental offices, and that is a great plus. We want to keep our patients safe. We keep them safely distanced. We don't keep people in the waiting room. If we do, they are definitely separated, but they also have the option of waiting in their vehicles until we're ready to see them. We do everything we can to run on schedule so that your wait time is at a minimum. We dedicate then the entire appointment to you, the patient. One of the other things you'll notice is that when we do treatment, we try to group the treatment into smaller segments that can be accomplished within the time that you're there. We try to make sure that we take advantage of the time and cut your returns and your visits to a minimum. So those are some of the changes that we're seeing in the dental office. So first of all, dentistry is not going away. It's here. It's an important part of total health care. In fact, as we're seeing patients that come back that have been away from the dentist, we're noticing more gum disease, we're noticing more tooth decay, we're noticing more TMJ problems, we're noticing more cracked teeth, cracked fillings, and dentistry plays an integral part in our total health. When we look at a person's mouth, we can tell a lot about their overall health. So dentistry is absolutely important. Our ability to chew efficiently starts in the mouth. Our digestive system starts in the mouth with proper chewing. Inability to chew correctly can cause digestive issues. Infection, if you develop infection, isn't just going to stay in your mouth, it's going to spread throughout your body. So dentistry plays an integral part of this. Another thing that we'll notice is, what does it do for us socially? What does a nice smile do for us socially? What does a nice smile say about us and our ability to interact and socialize with other people? That's a really important element, something that a lot of people notice once they start missing front teeth, once they start fracturing front teeth, once things start looking differently. So that's kind of a summary of where dentistry is going. I think, in fact, I really know that one of the most important things is that we get a proper diagnosis. I don't want to look at my patients through tunnel vision goggles. I want to look at the entire picture. I want to know everything that I can that's going on. I'll start with x-rays. I'll do examination. I'll do screening for oral cancer. We'll look at your gums. We'll look at your joints. We'll look at so many things that might show up in your tissues that could contribute to your oral health and your whole physical well-being. So that is something I think that's very different. We look at this, and another thing that we do is we want to consider what are your desires, what are your needs, what are your expectations, and we want to sync that together, what we're able to do in the way of treatment. So this is kind of like constructing a house. When you construct a house, you want to have a blueprint. You want to know where you're going. You want to know where you're going to end up. And you want to refer to that blueprint as you proceed. Well, the same holds true with dental care. We don't have a blueprint, but we have a treatment plan in place to serve your needs. So the thing is to have a great idea of what the patient's needs are. You know, what are the most pressing issues to take care of? Sometimes it's really simple. I do 1 or 2 fillings, or maybe we just clean your teeth. Maybe that's all you need. There's other cases that become more complex, more critical, and it's important that we sequence the treatment in a way that makes sense and is going to address the things that are more urgent. I want my practice, I always say, what we do for our patients is patient-driven, is patient need-driven. What does a patient need? What do they want? It doesn't matter what I want to do. It's up to the patient. And by no means does it matter what the insurance wants to do. This is not insurance-driven, it's patient need-driven. So that's kind of a touchy subject, because I want patients to take advantage of their insurance. They need to understand that dental insurance is not the same as medical insurance. In some cases, it's just going to cover a really small portion of what the total need for the patient is. What I don't want is to decide, I'm going to do this because this is what the insurance wants me to do. The way I see it is that I'm the one interacting with my patient. I'm the one making a diagnosis. I'm the one that will be doing the treatment, and I have to do what's right for the patient, not really what's right for insurance. It gets a little bit touchy, but we definitely aren't saying don't work with your insurance. Yes, work with your insurance, but don't let it dictate and drive your treatment. Thank you. I hope this is helpful. If you have any questions, please give us a call. We're here to serve you. Thank you.